Hello everyone, and thank you so much for joining me for today's lecture. We are going to look into ISO 9001 and 21 CFR Part 820.100 Subpart J related to corrective and preventive actions. And of course, we will go over the FDA warning letters and the Form FDA 483. Okay, here we can see the text coming from ISO 9001 related to corrective and preventive actions. I'm going to read the text first, and then we are going to explore this topic further in the next slides. So when we open the ISO 9001 text, in section 8.5, with the title Improvement, we can find several subsections such as 851, 852, 853 that we are going to cover in the next slides. So in section 851, which is a general section, it stated that the organization shall identify and implement any changes necessary to ensure and maintain the continued suitability, adequacy, and effectiveness of the quality management system, as well as medical device safety and performance through the use of the quality policy, quality objectives, audit results, post-market surveillance, analysis of data, corrective actions, preventive actions, and management review. Now, in order for any company to be in compliance with ISO 9001 standards, we can now understand through the interpretation of this paragraph what a company needs to do. So when we are talking about a company, a manufacturing facility, we will see that in order to maintain a continued suitability, we need first to have a quality management system. So when we talk about the quality management system, we are talking about a system with its inputs, processes, and outputs, and the quality management system that we have must allow us to do the documentations, to keep track of all of the hiring, all of the trainings of the personnel, all of their qualifications. We also need to keep track of all of the complaints, all of the deficiencies, all of the procedures that we follow in order to find out the reason why we had some deficiencies, and then to have procedures to correct the situation. And all of these different information, including even surveys from clients as well, list of SOPs, list of equipments, serial numbers of equipments, any type of repair, all of this type of information will be in a quality management system that allow a company to again maintain the continued suitability, adequacy, and effectiveness. So now when we talk about the medical system, the ISO 9001 here, they also ask to have medical safety and again performance through the use of quality policy. So each company needs to have internal laws. These are what we call policies, and those policies are written in each company. Companies will have different ways to write policies, but those policies must be related to how the company is defining what is quality. And then employees must be aware of what is quality, because we need to have quality in each and every step of the design, production, sales, etc. So here we talk about having quality objectives that are written in the quality policy document. We also ask to have audit results. What is that exactly? When we are asking for audit results, it means that we need to have audits. So examination of a product, a system or a process. This means that we need to have an SOP, a standard operating procedures for conducting audits. This means that we need to have trained individuals from QA, Quality Assurance Department, for example, to conduct audits, and this is where our Quality Assurance or QA department must have an audit plan for the entire organization. And then when we talk about audit results, it means that we need to conduct the audits now through the even third parties, people, again, inspectors, auditors outside of the company, and or internal QA personnel, then to document the results of those audits in order to make sure that we are maintaining the continued suitability, adequacy, and effectiveness of the products that we have. We also need to have a post-market surveillance. What is that exactly? This is a system that we are going to build, use, and maintain in order to look into any untoward medical occurrence experienced by our customers using our devices or our products. When we talk about post-marketing, it means that we are not just going to look into any safety issues or potential issues just before going to the market. We will also need to look into those probabilities of having any patient experiencing any untoward medical occurrence using our products after having the product or here the device on the market. So we need to have a system in place to collect, assess, and report, and then to prevent those adverse reactions. Of course, in Canada, we call the system that in Canada we are using is, again, the MedEffect system by Health Canada, where, again, customers as well as companies, they have to send what we call mandatory reports that are safety reports. In the USA, for example, we do have, again, FDA Form 3500A, where manufacturing facilities, companies, they have to, again, collect, assess, complete the form, and then to send it to FDA, as well as having a system in order to prevent harm to, again, any potential customer who may be harmed by the use of our products. And then we also have another topic here, which is the analysis of data. This is because we are going to use data. The data can be coming from different equipments. It may be the number of accidents per day. It may be the number of deficiencies per day, the number of complaints received per day. It may be the number of issues with labeling, for example. It may be the number of, again, warning letters that a company is receiving from FDA. It can be any type of data where Quality Assurance Department needs to do the analysis, to look at the trends of the data. If we see that, for example, we have more and more accidents, or even same number of accidents every day experienced by our workers using an equipment, obviously it means that there is a correlation in between, again, the age, maybe, or deficiency of the equipment and the number of accidents. So it should trigger a request to repair or to replace that equipment. Now, doing the analysis of data is going to allow us to look at the trends in the complaints, trends in, can be, of course, customer satisfaction. You're more and more happy about our our products. It can be again a trend for the number of FDA warning letters. We may have less and less warning letters over years because we are now in full compliance. We have a highly trained again people, and we are having a very strong management, very supportive management with very clear standard operating procedures. Another important again fact that we see here, the requirement, is corrective actions. Corrective actions means that when we are looking into any incident, any complaint, for example, any warning letter that we receive from FDA, we will need to do the analysis of that complaint, that issue that we receive. We need to do what we call a root cause analysis in order to understand the root cause of that issue. And once we know about the root cause, we need to have procedures, so standard operating procedures or SOPs on corrective actions. In those SOPs, we define the scope of the SOP, we write down which departments or which positions are involved in the corrective actions. We will then write different steps in order to follow, to again understand and then to perform the corrective actions. And then we also need to have different departments maybe involved in the corrective actions as well. So the SOP must have a form, online form, or again can be also in writing, but a form where we also take into account that any report, any intervention, or any validation or inspection, or any report on the completion, for example, or verifications, they are all embedded into that form, and we may have several departments involved in that corrective action. We also have the preventive action. It means that when we are going to correct any situation, any issues, responding to complaints, looking into deficiencies, resolving any type of potential issues that we may have in order to maintain the continued, again, effectiveness of the system, of the company, we will need to put in place preventive actions. Now, this is another procedure. Sometimes in a company we have corrective and preventive actions. We call those CAPA, C-A-P-A, corrective and preventive actions. And in the preventive actions, we need to set or put in place several actions. This may be reviewing or continue reviewing of the equipments. It may be inspection of equipments every 5 days. Example. It may be retraining employees every 4 weeks or every 6 months. It may be setting some limitations or some requirements from employees who are working in those equipments. And again, the type of preventive action will be different depending on what were the corrective actions and what are the actions that the company is going to perform in order for, again, the company to make sure that those issues will not come up again. And obviously, the last important point is the management review. Why? That's because management has to know about what's happening in the company. It's not just the sales. It's each and every step in the procurement, hiring, storage, preparation, changes, labeling, delivering as well, training of employees as well. So there are so many different steps that are again happening in any manufacturing facility. When we are writing policies, the management needs to make sure that the policies are written. They are also learned by employees. They have to give updates about those policies as well. we need to send memos, we need to give trainings, management needs to review, of course, all of the SOPs as well, because their job is to manage. Now, let's go over ISO 9001 and about other clauses. So, the corrective and preventive action requirements are indeed in clause 8.5 that we saw in the previous slide of the ISO 9001 as of 2015 standard, specifically in section or clause 852 corrective action and 853 preventive action. Now, clause 852 focuses on corrective action, requiring organizations to take action to eliminate the root causes of non-conformities to prevent recurrence. Obviously, we need procedures, we need training, we need audits, so that we will make sure that there is a continued sustainability. For the clause 853 of ISO 9001, it focuses on preventive action, which involves taking action to eliminate the causes of potential non-conformities in order to prevent their occurrence. And of course, we do have SOPs in any company on corrective actions and on preventive actions. You may also see SOPs on CAPA, corrective and preventive actions. Now let's look into FDA regulations. Here we are looking into 21 CFR, section 820.100, subpart J, related to corrective and preventive actions, similar to ISO 9001, clauses 8.5, 1, 2, and 3. Now here I'm going to read what is required by the FDA, by USA government. Each manufacturer shall establish and maintain procedures for implementing corrective and preventive actions. The procedures shall include requirements for analyzing processes, work operations, quality audit reports, concessions, and then investigating the cause of non-conformities. Number 3, identifying the actions needed. Number 4, verifying or validating the corrective and preventive actions. Number 5, implementing and recording changes in methods and procedures needed to correct and prevent identified quality problems. And of course, it goes on and on, very similar to what we saw in ISO 9001, clauses 8.5, 1, 2, and 3. Now, coming back to ISO, clause 9001, clause 825, related to corrective actions, the organization shall take action to eliminate the cause of non-conformities in order to prevent recurrence. So any necessary corrective actions shall be taken without undue delay. And of course, when we talk about undue delay, that's because we have a quality management system where when we receive a complaint, any report, it's already time-stamped. So when we look into any deficiency in non-conformity, the job of QA is to right away trigger a root cause analysis, and then to try to find out the root cause and then to correct it. And everything is already timed, and it's not just a matter for the company to inspect that or audit that. They do, but it also, if we have an inspection from Health Canada or from FDA or from EMA or any other country, the same thing applies. We use, again, the timestamps as well in order to make sure that companies are in full compliance, not only by having their SOPs or procedures, but also by following their procedures. Now, the organization shall document a procedure to define requirements, A, reviewing non-conformities, including complaints, because complaints can be internal or external. Then point B, determining the cause of non-conformities. This is root cause analysis. Point C, evaluating the need for action to ensure that non-conformities do not recur. Here we are talking about looking into corrective actions. Point D, planning and documenting action needed and implementing such actions, including as appropriate, updating documentation as appropriate as well. And then point E, verifying that the corrective action does not adversely affect the ability to meet applicable regulatory requirements for the safety and performance of the medical devices. And the last point is to review the effectiveness of corrective action taken. So when we would like to become ISO 9001 compliant, we need to have all of these, to follow all of these different requirements. We need to have different procedures, qualified individuals, support of the management, trained, of course, employees, and then making sure that we also conduct audits again in the company so that everyone is in full compliance with company policies, company regulations, international standards, local and regional regulations and requirements as well. And again, this is part of the, the job that we need to do. Now, records of the results of any investigation action taken shall be maintained. Now, corrective actions, they should address systemic problems. For example, changing the procedure and training of personnel to the revised procedure might not be itself be appropriate or sufficient to address the systemic causes. But if there is an issue with the equipment, for example, any issue because an employee doesn't know how to use optimally an equipment, or an equipment that has been repaired and it has not been validated, for example, these are all systemic problems or issues that must be faced. Now, when we talk about improvement here, based on the logic of what we learned, not only for in the US regulation, but also in ISO standard, we, as soon as we have a complaint, internal or external, or a report about any non-conformity, it triggers an investigation. This is what we call a root cause analysis. And this is why we talk about identifying the cause or causes. Then we need to identify what we need to do. These are corrective actions. Then we need to verify and validate that the corrective actions, again, were sufficient and they were efficient. And then we will now implement those actions in order to correct the system. And then we are going to determine effectiveness of implemented action. Of course, for each and every of the steps that we are seeing here, we need to have procedures. Of course, a procedure or an SOP can have all of these at the same time. So it may be a process improvement, for example, the title of the SOP. But we need for each and every of these steps to have those steps documented. Now, it can be, again, through a checklist, where we can, at the end of the SOP, in the annex, write down or put a checklist where we are going to say, okay, we define the problem in box 1, then it has been investigated by whom and when and how. Box 2, checked. Then we did identify the cause being what, done by who, and at what date, and then we click on check. So same thing for the next rows, for a verification or validation, for implemented actions, and for determining effectiveness. So this is, again, in a nutshell, the improvement process, and we are now looking into, of course, the logic behind what we see in the ISO and in FDA regulations. Now, let's go over the root cause analysis or investigation. Good practice shows that a documented plan should be in place prior to conducting the investigation. It means that we cannot just wait so that anything happens and then we sit and we look into what we can do now. No, the opposite makes sense. It means that we are going to have procedures to follow whenever we may have any, again, challenges, and of course challenges because of non-conformity. So the plan should include the description of the non-conformity expressed as a problem statement. We also need to have another box, another section for writing about the scope of the investigation. So the scope meaning what is in the investigation and what is outside of the scope of the investigation. Then we need to have another section for the description of activities to be performed, followed by resources, people, or again any equipment, for example, used for that, and then followed by methods and tools for the analysis of the root cause, and then the time frames. So when we are receiving a complaint by QA, for example, internal or external, and we are going to add that complaint into our quality management system, we will be able to assign a group, the task, of course, to the group, and we can ask the group or a person, individual, in order to go over the root cause analysis tasks. So in the system, the person who is now in charge is going to read the complaint. Now he or she starts the root cause analysis. And how it started? By documenting the root cause investigation, where in the same quality management system, the person is going to accept the complaint for a task, and then he or she is going to be directed to a form on a web page, for example, where the person needs to now document the issue, the non-conformity. And then each and every action needed in order to find the root cause must be written, and it must be completed by that individual. And of course, the time frame is very important, because the individual in charge now of resolving this non-conformity needs to write down about the methods that he or she is going to use, about the resources, about the description of the activities, and then to set a time frame that must be respected. Don't forget that this is for internal uses, but when we also have inspections from FDA or from Health Canada, for example, we will still need to have the timestamp in order to be able to give a list of all of those non-conformities or complaints, and then to show to inspector of Health Canada, FDA or EMA or other country that we do have our procedures, we have our systems, that this is how we receive complaints for non-conformities, and this is how we follow the procedures, and here are examples of or proof of the fact that we are in full compliance. And then we can now make reports from the quality management system on each and every case or complaints that we received, and we can give to the inspector the list of all of those complaints and all of the actions that have been done in order to correct and to prevent those non-conformities. Now, when we talk about the root cause analysis, as I already mentioned, we have several tasks. So first, we have to define the problem, and I already explained that in the form, in the SOP that we may have for the root cause analysis, we will have a form where we will have to obviously define the problem. Then we will need to collect data. We are going to observe, we are going to do calculations, maybe doing measurements, maybe conducting interviews, but they are all going to be pieces of information, so this is data that we are going to gather. Then we are going to identify the possible cause or causal problems. So here again, we need to document, again it's another section, in the form for the root cause analysis, that we are going to perform this task. Then we are going to identify the root cause based on the discussions in between the person in QA in charge of resolving the issue, or a person in charge in a department in charge of looking into the root cause analysis. So we will have subject matter experts who are going to work together and then to identify the root cause and then to write it down, because we need to document. If it has not been documented, it has never been done. And then at the end of the form that is related to the root cause analysis, the team or the individual will need to write recommendations and to do something. We call that implementing the solutions. So when we talk about implementation of the solutions based on the root cause analysis, we are talking about corrective actions. So now the corrective actions must be documented as well. This is why we have to go through different steps in order to go over receiving a complaint, assigning the complaint to someone, looking into the person doing the root cause analysis or investigation, and then to write the corrective actions. And obviously, after the corrective actions are done and validated, we are also going to have to need to document all of the corrective actions that we did put in place in order to prevent this non-conformity to happen again. Now, what are the methods for the root cause analysis? We can, for example, do the causal factor tree analysis. We can use the fishbone diagram. We can look into the change analysis, if something has been changed, and do the analysis. We can look into barrier analysis. So if something is preventing, someone or a machine or, I don't know, equipment, for example, to do the right thing. The 5 whys, who, what, when, etc. The risk tree, we can also use, a type of structure like a tree, and then to write down what are the risks, and based on the risks, we will be able to find out the root cause. We may also look into parent analysis, so looking into what came or what goes before the non-conformity may happen, and look into what are the roots of that issue. We can then also do the fault tree analysis. So here we are looking into what equipments may be faulty, and then because of that we may end up having a non-conformity. We can also look into management oversight to see to what extent the management is effective in doing their job. And we can also have failure mode effect analysis, where we are going again to look into the entire system, and we are now going to say, okay, if this equipment doesn't work, what may be the consequences? If the second equipment doesn't work, what would be the next consequences? If both are not working properly, then what would be the consequence? So this is through this way or this method that we'll be able to find the root cause of any non-conformity. Again, in order to know more, I'm inviting you obviously to go on different libraries or on different valid sources in order to look into different root cause analysis methods that we use in the industry. Now, what are the causes or contributing factors of non-conformities or potential non-conformities? So based on the experience that we had in the industry, we know that the following may be the causes or contributing factors. One of them is inadequate or non-existing procedures and documentation. Procedures, talking about SOPs, or they are not clear, or they are too large, too big, or they don't have any visual element, and people have not been necessarily trained on them. The other one may be documentation of how to the best way use an equipment or documentation on any procedure. Then it may be non-compliance with procedures, so employees are not following the procedures, and that's why we are having non-conformities. It can also be an inadequate process control. So we are not controlling how things are working. Now the control may be again having different steps of inspection or audits in between different I would say intermediate products, for example. Again, it will depend on what product we are talking about. Then inadequate scheduling. Again, it may also affect the again the quality of the product. It can be lack of training that I already explained, stated that. It can be inadequate working conditions because the working conditions will also affect employees. It can also be failure or malfunction of or incoming materials or processes, tools, equipment, or facilities in which product is processed, stored, handled, including the equipment and systems therein. And of course, different process variability, meaning that we call it about inherent process variability. It means that sometimes you may see that an employee is using an equipment, if this is caused by an equipment, but the person is going to take shortcuts. The person is not going to follow exactly the right work instruction. And this is, and again, for some other, say, cases, we may have a process that has been changed or improved. However, it has not been documented. And employees, they just learned on their own. And then we lost control of, okay, what is happening when, again, workers are working, for example, on their specific equipment. This is where we need, of course, to have an audit plan. And this is what, again, the QA or Quality Assurance Department does. Now, talking about action items, here let's talk about the corrective action plan. So this is the development of a detailed description of implementation of corrective actions. So it's also a review of regulatory requirements like submissions, licensing, and certifications. Now it's also definition of roles and responsibilities for execution of action items. It can also be identification of the necessary resources like IT, infrastructure, work environment, verification and validation of the protocols, implementation schedule including timelines, identification of method or data for a determination of effectiveness with acceptance criteria for the quality of the products, and identification of the starting point of monitoring following the corrective action. So these are all examples, good examples of actions items when we are looking into implementing a corrective action plan. Now, talking about the verification and validation. Verification activities ensure that all the elements of the proposed action, including activities such as documentation and training, will satisfy the requirements of the proposed action. Now, it must be completed by persons knowledgeable in the design and development or use of the product or process that is subject of corrective actions. And validation activities generate data and information that confirm the likelihood of the effectiveness of the corrective actions to eliminate the non-conformity, etc. But what is important is that when we look into the validation, we are looking into, again, creating a checklist, making sure that each and every function of the device or an equipment or, again, a software, for example, is working. Now, when we are, again, having some type of non-conformity, if the non-conformity is because of an equipment deficiency, for example, we will need to verify the activities, we'll need to repair the equipment, but we don't use the equipment unless the repaired equipment is validated. So we will have to go over each and every function of that equipment. We check them through a checklist. We have to, for example, if it turns on, yes, it does. We have to check a box because it says that the equipment turns on. Now imagine that the equipment has a very complex functions, and then we have to go through each and every function in order to validate each and every function and write down on a validation checklist that each and every function of the equipment is valid. So this is the validation, and again we also keep the documented proof of the validation that has been done. Now, talking about examples of items to be considered when planning the verification and validation, we have to have these questions. So does the action eliminate the identified root cause? Does the action cover all affected products and processes? Does the action adversely affect the final product? Now, is it possible to finalize the action in a timely manner to a planned schedule? And of course, these are all examples of items that we have to consider for the verification and validation. So these are types of questions that you will also see on the verification checklist or the validation checklist, and checklist that is being used by auditors or inspectors. Now, let's talk about preventive actions. This is clause 853 of the ISO 9001. So here we talk about the organization that shall determine action to eliminate the cause of potential non-conformities in order to prevent their occurrence. So preventive actions shall be proportionate to the effects of the potential problem. Now here, the points that are important for the preventive action that takes place after the correction, of course, of any non-conformity are the following. So point A, determining potential non-conformities and their causes. Point B, evaluating the need for action to prevent occurrence of non-conformities. Point C, planning and documenting action needed and implementing such actions. Point D, verifying that the action doesn't adversely affect the ability to meet applicable regulatory requirements or the safety and performance of the medical device. And the last point, which is reviewing the effectiveness of the preventive action taken as appropriate. So records of the results of any investigations and of action taken shall be maintained by QA in the document management system. Now, you may say, what is the difference in between corrective actions and preventive actions? So on the left of this slide, you can see that the first column is talking about the corrective action. So these are, it deals with the non-conformity that has occurred. But the preventive action is dealing with potential non-conformities, failure, that of course that has not been occurred yet. We can also talk about the objectives of corrective action that are to prevent a recurrence, but the objective of preventive action is to prevent the occurrence. The corrective action focuses on past events. The preventive actions focus on potential future events. Corrective actions require root cause analysis. Preventive actions require risk or trend analysis. And examples, for example, is installing a backup filter after an incidence of filter choking. This is an example of corrective action. An example of a preventive action is to install an alarm to warn you when your process is drifting out of acceptable range. Let's talk about warning letters. When it's consistent with the public protection responsibilities of the agency and depending on the nature of the violation, it's FDA's practice to give individuals and firms an opportunity to take voluntary and prompt corrective action before it initiates an enforcement action. So warning letters are issued to achieve voluntary compliance and to establish prior notice. So the use of warning letters and prior notice are based on the expectations that most individuals and firms will voluntarily comply with the law. So the examples of enforcement actions that can be done by regulatory authorities such as FDA, Health Canada, EMA, etc. are the following: recall of the product, seizure of the batches, injunctions of the company, administrative detention, civil money penalties, and of course prosecution. Now, warning letters, again, this is an informal and advisory tool. It communicates the agency's position on a matter, but it doesn't commit FDA to taking enforcement actions. So for these reasons, FDA doesn't consider warning letters to be a final agency action on which it can be sued. Now here is an example of an FDA warning letter. I'm going to read the first paragraph of this letter, which is at the bottom of the slide. So, dear Mr. X, this is to advise you that the U.S. Food and Drugs Administration reviewed your website at the internet address, in February, and has determined that you took orders there for the products hemp oil and the CBD, cannabidiol soft gels, which you promote as products containing cannabidiol or CBD. The claim on your website established that the products are drugs under Section 201G, 1 of the Federal Food and Drugs and Cosmetics Act, which is not the case. And of course, this is a warning letter. Let's go over a second warning letter, again by FDA, sent by FDA. So here is the dear Mr. X. From January 27 to February 4th, FDA inspected your pharmaceutical manufacturing facility, etc. at what location? So FDA identified significant violations of current good manufacturing practice or CGMP regulations for finished pharmaceutical. So Title 21 Code of Federal Regulation, Parts 210 and 211, again are the sections that are having these regulations. So these violations cause your drug products to be adulterated within the meaning of Section 501A2B of the Federal Food and Drugs and Cosmetics Act. So these are warning letters that companies may receive by FDA. And of course, they are published and they are publicly available on the FDA website. Now, they are issued only for violations of regulatory significance, and significant violations are those violations that may lead to enforcement action if not promptly and adequately corrected. Hence, when we receive, or companies, they receive warning letters, it needs a prompt action from the company to respond back to the warning letter. Now, responsible officials in positions of authority in regulated firms have a legal duty to implement whatever measures are necessary to ensure that their products, practice, processes, or other activities comply with the law. So they should not assume that they would receive a warning letter or other prior notice before FDA initiates enforcement actions. Now here, these are several steps to respond to an FDA warning letter. So the step 1 is to review the warning letter in detail. The step 2 is to perform an investigation. Step 3 is to respond to the warning letter by the deadline. Step 4 is to keep the FDA in the loop with the next steps. Step 5 is to determine an action plan. Step 6 is to provide a timeline estimate for the corrective and preventive action plan. Step 7 is to meet with the FDA to discuss your plan. And step 8 is to treat it as a learning experience. Now, talking about the drafting warning letter responses, similar to Form 483, upon receiving a warning letter, an organization has 15 working days, so business days, to respond. Now, how you are going to answer? The format is the following: a restatement of the observation, the proposed corrective action or plan, reference to the specific CAPA numbers in the company QMS system, ensure root cause is determined and addressed, potential impact to the product, potential impact to the quality system, and the targeted date of completion. This is a FDA Form 483. And again, as you see on the top, we have the placeholder for writing the discrete address and phone number. We have the dates of inspection by FDA. We have the FEI number, then the name and title of the individual whom report is issued. Then here we write the phone name, the city, street, etc. We write a summary and we talk about these observations. And then here we have employees and their signatures. In order to see a completed form FDA 483, I'm going to show this in the next slide. So here, this is a completed form 483. As you can see again on the top, we do have enough information. Now the company needs to complete this form by, of course, looking into the observation of FDA, but also now to, again, write the observations and what the company is planning to do as per what we saw in 2 slides before this slide. So in a nutshell, we went over, again, the corrective and preventive actions, and we looked into the FDA warning letters today. Thank you so very much for your attendance, and I wish you all a very good day. Thank you.